Welcome to the after show of healthcare quality and risk matters. My name is Gary Bierce, and I'm joined by my two esteemed colleagues and co-panelists, Rob Sanamore and Dr. Timothy Brown. Welcome to the after show. If you guys had a chance to be part of our live podcast, we're talking this month about the C-suite and a C-suite strategy and how putting quality at the core of that, and it can bring a radical change to your organization in terms of profitability, but also just overall marketing and reputation and top of the line leapfrog scores or whatever you want to throw at it. And so we're hoping that some C-suite members have been joining us not only in the live broadcast but also in this one, because this message is really for you to understand that when you put quality at a core of your strategy, you're going to get funding mechanisms from within, operational funding mechanisms from within. They're going to free up capital and the ability to invest in ways you can expand your organization rather than looking at quality as a way just to defend yourself from decline. It's really an opportunity or a competitive advantage would be a better word, right, Rob? If you apply it appropriately. So we talked about in the main podcast about the demise of Genesis. You want to kind of just quickly go over that again, Rob, and then we can put up our graphic and let's talk about how Aperitisoft can solve these problems.
Yeah, just high level, Genesis Healthcare was a massive. There's long-term care, rehab, skilled nursing organization that was across 34 states with like 1,800 rehab facilities, and there's 500 skilled nursing facilities. And then after there's kind of spiraling downward in their quality programming, some legal there's concerns such as like false claim settlements, some civil actions. There's wrongful death suits, right? They're operating at 175 facilities in 17 states, which is of course like less than half of what they were, or like as an organization, they're crumbling. The patients have suffered greatly. I mean, look at how many patients, one, are displaced and have no care. And two, people actually died.
Yeah, and you think about not just the patients, but also their families.
Yeah.
And just how much these people have gone through because of a simple thing of not having the right mindset with quality and how you drive and manage your business and your strategic direction with it. It's pretty sad. Now, during the podcast, we put up a graphic, Rob. You want to put that up?
Yeah.
So in this graphic, we're trying to represent how quality really is at the core of three main parts of your organization. That if you take a quality direction, you're going to change your culture to be emphasizing quality as the essence of how you achieve excellence in your business. Second, you now think of risk management proactively, not reactively. And that alters the way that you handle the various risk management processes. And then lastly, you start to align quality and the way that you manage quality into your strategic planning, how you think about budgeting, your process management, and even how you allocate resources in your organization. So now what we're doing is we're feeding this idea of quality that can then surface the top levels of quality. In the podcast, one of our participants, Mr. Bailey, discussed that this leads to becoming an HRO, highly reliable organization. So therefore, you're going to see continuous improvement in how you operate. You're going to start making data-driven decisions. And we're going to talk about here in a minute, you need to apply technology that not only carries you there, but helps you to accelerate what you're doing, which all results in financial impact. You're going to start seeing, revenues increase. that means lower costs, this all means profit.
Mm-hmm.
Rocket science, right? So why don't we talk, guys? Let's shift around a little bit now. We talked about generally how this is. How does Aperitisoft Healthcare help to pull all this together? Timothy, how would you describe how Aperitisoft Healthcare can help somebody execute on this strategy?
Well, I think the biggest thing is you're going to have to focus on good data in, good data out. That's one of the biggest things that I've learned in working in healthcare and also working with um, data-driven processes. You have to put the information in, some way of tracking what's currently going on in your organization. And to me, a parity solve is that key ingredient to help you identify what's specifically going on. And we train your employees to understand how to put this information in. It's very, very simple, which allows them to be able to do it quickly, efficiently, and then the data goes to the right department to be able to disseminate. So having good data from that standpoint allows us to get the picture of what's currently going on. From there, we can identify what areas are our biggest risk from looking at those particular incidences that are placed into the system. We can start to mitigate some of those incidences by doing maybe CAPA management or building out a plan to execute what those particular high stress areas or high risk areas are for the organization. Building out those plans allows us to, number one, hopefully reduce those from happening over and over for your organization, whether that's slips and falls, whether that's sepsis or whatever is going on in your organization. Helps us to identify those key areas, but also it helps us to build out plans to keep our eyes open for other things that may also be happening within your organization that could cause additional risk and additional cost going out for the organization. Lastly, biggest thing, and I always say for organizations, if you're not able to audit or do an assessment of your organization to see what's currently going on a grander scale, you need to be able to have that ability. Because when you have JCO knocking at your front door, or CMS is popping up, doing the overall assessment, you need to know what's going on before they do. And if you can show that you are aware of key issues or key areas that can potentially harm patients or lead to greater risk for your organization, it shows that you have a more proactive approach to reduce risk for any patient that may be coming to the organization. And that in turn turns into lower fines, if any at all. But it also empowers your employees to be able to have a space where they can tell all really to keep patients safe and to communicate with their overall leadership team. Because if they don't feel like they can, they're not going to. I definitely have found that out.
Yeah, yeah.
Aperitisoft does it all.
Rob, how do you see Aperitisoft Healthcare, picking up the ball and helping an organization to achieve what we have on our graphic right here?
I think that with some C-suite support, that it actually rolls out. There's all three of these key points that we hit. There's not only does it act as your operating system where you can jump in to grab the information that you need to make. There's decisions about what you're doing and not doing with resources. But it helps create that culture. There's by being a very user-friendly, there's logical interface that people want to consistently and there's thoroughly dive into on a regular basis. And it ensures that there's good risk assessment proactively, that we manage things that do happen well. And honestly, just having the program that is user-friendly and smart, that gives people the opportunity. There's the ease of use, right? There's the culture around, there's documenting, around using quality, around keeping quality in the forefront. I think that is a huge impact. And I think, right, being a quality risk and compliance leader in healthcare for so many years, having one dashboard that I could go to, or a set of dashboards, however you set it up, and say, I know where we need people today in the organization. I know where we need resources today in the organization because of the data that was put in, because of the culture that we created, of the risks that we identified, because of our proactive risk management and risk identification. I know that, listen, I am in dire straits with staffing. Everybody is today. But if I'm going to allocate resources, I'm going to go to my dashboard and say, you know what, our emergency department has had an extreme number of falls in the last 36 hours, and it's been on the night shift. And I can say, I'm going to put somebody on the ICU, or I'm going to put somebody in the ER. I know I'm going to make that seems like a small thing, right? What am I going to do with one staff member? But that one staff member is going to prevent a wrongful death suit because you have the data that makes sure that you know that I put it in my higher risk area because it's been identified. And that compounds, right? Like you can use this to make every decision across your organization, and it'll make all the difference as to whether or not you're an organization that maintains quality and continuously improves, or you turn into Genesis Healthcare and you get cut in half, and who knows if they're going to be around at all in a couple of years.
Right. It's interesting, if you're a C-suite member out there and you're saying, well, what's so special about you in Aperitisoft Healthcare? I mean, you've got a lot of big players out there. There's Midas. There's, I guess now called IdeaGen. There's RL Datix, Qualtrics. What are some of the others, Rob, that are out there?
And there's a whole bunch of them. There's it depends on what you're looking for, but there's all these disparate quality management systems.
They all take little pieces of things.
Yeah.
But what they don't do is do it all. And the other problem with them is that they take very much of a pure relational database strategy approach. So, it's all about getting data in, and it's not very fancy on how that data is brought in, but they're just going to give you forms that put data into your system. And then they're try to give you some really slick looking dashboards based on what that data may be. And that's functionally what the programs are doing. I always say it's like, different colors lipstick on the same pig, right? And that's really what's happening. Well, then what makes us not a pig? Okay. And what's making us different is that we've taken a step back from this whole problem. And we realize that the real issue in technology with healthcare quality systems is they're not taking a risk management approach to things. So what we have put to code is how to drive the risk management process front to back, fully integrated. So when we're taking, for instance, in the risk area here, and we're looking at risk identification and mitigation, and say we're looking at it from an incident perspective, the incident enters the system in a very seamless and automated way that reduces the amount of time it takes to report an incident, gets all the information necessary, and gives a little automation so that you can get criticality on that incident. Is this something I got to respond to right away, or can I wait a week before I look into this, right? But then it drives you through the process of investigating and analyzing and gathering all the data around that incident, both quantitatively and qualitatively, which results in a score, a quantitative score that now you can prioritize on. But we didn't stop there. We went all the way through to the corrective action, preventative action strategy you're going to deploy on that incident, and show how when you get these things done, your quality score starts to come up. Now, I don't know of any other system that attempts to do this, but we went further. We realized that when you're managing quality in a hospital, you need to be able to get ahead of regulation. So how can we bring in the regulatory requirements for whatever organization I have? We have an organization that is a long-term care facility in Florida, and they have these what they call ACA rules. These ACA rules can be then uploaded into the Aperitisoft healthcare system. You can pre-audit yourself. You can go through these regulations and look at how you felt you've done and start to take your own CAPA action on your own self-assessment. And then when the audit does come in, what do they have to say? If they disagree with your self-assessment, you make a correction to it, and then you add you add CAPA to it. But what are you telling the auditor by taking that approach? It's going back to what the Mr. Bailey said in our podcast. We're showing that we're trying.
Yeah.
Right? We're putting in that effort to try. And then we didn't want to leave you short there either. As you develop these policies, these procedures, there's a whole document control system in the Aperitisoft Healthcare to help you keep that straight. So what I think we're doing that's different, that means that we're not a different color lipstick on the same old pig, is that we're now listening to what you need from a process perspective and giving you the tools to do that. Now, Rob, you've been in the industry a long time. Okay. How does Aperitisoft Healthcare, how can it be a game changer for a healthcare organization?
So, Gary and Timothy, you both know my marble composition notebooks that I whine about all the time. That is how I was trained by, and I couldn't say anything negative about her. She's awesome. She's very knowledgeable. She's wonderful. She taught me so many things. But she taught me how to manage my quality, my risk, and my compliance with just different colored notebooks. So you kept saying different colored lipstick, and I just kept picturing my different colored notebooks, marble composition notebooks. I had nothing on my desk other than like those notebooks, right? Like, and there's what I worked for in a time where I had 3 computer monitors and I had all of these other operating systems for my EHR. I had financial auditing systems. I had systems for, there's inventory management, clinical supplies and laboratory. So I had all of these great tools to help me do my job, except for quality. Yeah. Nothing under the quality umbrella did I have a tool for other than a paper and pen. One, I can tell you, that the continuity of the quality program was completely dependent on a person, which is extraordinarily dangerous.
Yeah, wow.
I was also not able to quickly or intelligently communicate my needs to my C-suite. I was told over and over and over and over again that your department does not make us any money. I am not going to give you more staff. Figure it out. And more often than not,
that's just not true. That's just not true.
Oh, over and over again, I would argue that, right?
Yeah.
And I would tell them that we're going to cost you money if we don't. And it was so hard to prove it. And it was years before I was able to make a little headway. And all of a sudden, they gave me 2 more staff. Great. And honestly, I think it was just because I was complaining so much and it wasn't worth it to listen to me anymore. And well, now we're getting more money in. There's more processes are improving. Our last audit was clean. We started to do better, and then suddenly I got 2 more. But it took years to get there, and at like 80 hours a week. And then when I left, they tanked for a minute.
It's interesting you talked about that, Rob. Mr. Bailey brought up the idea of predictive, right?
Oh, I did none of that.
Now, what we didn't say but during the podcast, but we can tell now to everyone in the after show. Well, Aperitisoft Healthcare went even further. We've got a built-in Monte Carlo simulation engine.
Yes.
You can now put together a risk register of all the probable risk events that you are concerned about, not just in healthcare safety and quality, but operational stuff and strategic stuff. You can put it all in there. And using that Monte Carlo simulator, you can spit out what the expected impact in dollars terms would be for each one of those risks. So now you want to prove to the CEO that you're going to save them money. Show them, give me 100,000, and I'm going to reduce the expected value impact of incidents this year by $2.5 million. And you have the statistical analysis to prove that.
Yep.
That's a tool that makes a difference and speaks the language of the C-suite.
So true.
Absolutely. I would have loved data to walk in and show them. Everything was things that I was able to kind of like piece together to try to tell my story. And I knew logically it just made sense, right? Like better quality, like we're able to there's more of our work done. It's smarter, it's better for our patients. And I wasn't able to articulate it really other than that. And because I didn't have any of those tools, any of those there's data points that told me what was going to happen in the future at a high likelihood. Instead I was using historical things like hey, it cost us this much money because we didn't do this.
Yeah.
We had an incident that because I didn't respond to it and nobody on my team did, by midnight the night before, and I saw it when I came into work the next day at 7 a.m. and then reported it, we were 7 hours late. It cost us hundreds of thousands of dollars, including our CEO having to speak in front of a review board.
Wow.
And the actual issue wasn't that the event happened, it was because we failed to report it timely. The incident was completely out of our control.
Right.
And they acknowledged that. It was because we didn't report it. And by 7 hours. So like systems that are smart enough to tell you, hey, this one's like super big deal. Like it's at the top of your bar, it's in red, it's listed as critical. Like you might want to pay attention to this before.
That means do it now.
Right? Easy, not, oh, it got buried in a line of 65 other things. Right. And I didn't mark it on my marble composition notebook, and now we're in trouble. And things like that were my argument. And to try to improve quality, to try to get them to invest in quality, and to get them strategically thinking with quality in mind. And if I would have had an operating system like Aperitisoft Healthcare that could change the identify risk ahead of time, predict risk, and just in general support our operations, game changer.
It's interesting. I'm sorry, Timothy, go right ahead, please.
No, I just want to say this point to something that Rob just said. He said trying to get the leadership team to invest in quality. It's amazing to me that we have organizations that have quality stamped all across their mission statements, their vision statements, their core values, and then it's still pulling leg, arm, and teeth to get them to invest in what they say they actually believe in. It blows my mind.
It's a word that marketing knows that people like to hear, so they add it.
Yeah.
But you're right, if it's not at their core and they're not living by it, it's just a marketing word. That's all it is.
Marketing ploy. Absolutely.
Top CEOs that run businesses live on one word when they look at the financial performance of their organizations, and that one word is margin.
Mm-hmm.
Yeah.
Okay. So if a CEO were to say to you about quality that you're not making me any money,
yes, I am.
That's crazy.
I'm already irate at the question, and
because you're producing so much margin, right? It's all about margin. You're driving margin because of what you do in quality.
Mm-hmm.
That's what you do, and it's like the difference between, say, Rob, you make bicycles for a living, okay?
Sounds like a fun job, actually.
Yeah, they're really good bikes, and they're quality bikes, right? And somebody goes to the market and says to you, well, Rob, you can sell these for $1,000 a piece. And then I came up to you and said, Rob, if you would just do this, this, and this, you could start selling it for $1,500 a piece.
I should probably immediately go do this, this, and this.
And this, and this is quality.
Right.
Correct.
Right.
Yep.
I mean, that's what we're talking about. I mean, Walt Disney, my business hero, may his soul rest in peace, said quality win out, right?
And there's that book, there's What If Disney in My Hospital. And one of my first process improvement initiatives, the director of my ICU came and handed me that and said, you need to read this book, and then you can do this process improvement event. And I totally agree. In what I have told my leaders over and over and over again in the C-suite is quality is nowhere near as expensive as you think it is.
Mm-mm.
Every dollar you invest in quality comes back to you
10 to 20-fold.
There's at least. And sometimes it comes back to you in ways that you can't even measure. Sometimes it comes back to you in ways that you didn't predict. And because all of a sudden you have a change in culture, you have a change in public.
Number one impactful risk, in my experience as an enterprise risk manager, Rob, is product demand risk.
Mm-hmm.
Yes, absolutely.
You spend an enormous amount of money on product demand. I mean,
Yes.
that's what all these marketing programs are and branding programs. They're spending 10, 15, 20% of revenue to try to build up product demand when it's simple as reputation. That healthcare organization, they're the best in the area. So now you're calling, you know, if Genesis would have taken this strategy, by the way, then they would have a waiting list of people wanting to come to their facilities.
Absolutely.
You know, that's the difference when quality is put in the C-suite core strategy.
I couldn't agree more.
It's a game changer.
Oh, it is, and it does happen. We just had a family member. There's in the hospital very acutely, home safe now. But as soon as she was admitted, there's the majority of my family. We all started our text and we're like, get her out of that hospital and get her to this one.
Wow.
And universally, it was move her now.
Let's put a value on that, right?
And so not only did we, take from that hospital like their revenue, but their reputation made it so that we were immediately nervous about her going there and be like, oh no, like that's not gonna, like, if she might be going in for something small, but it will be big by the time she leaves. We're not doing
it. Drive an extra 2 hours and get her where she belongs.
It was actually 3 hours and we were fine. We would drive 6. And which is scary, right? In so many of our communities, there's across the country are in healthcare deserts where you have critical access hospitals or small organizations that you rely on to keep you well. And Timothy spoke about psychological safety during our podcast, and that really is important. Yeah. And if you want people to work for you, invest in you, help you grow, you're not going to go somewhere where everyone's scared to send their grandma.
Absolutely.
Right. I went in for stitches and came out with a staph infection. You know.
You nailed it. Absolutely.
That kind of thing. Absolutely. Yeah. And with Aperitisoft Healthcare, you know, to try to bring this home and back to what we do in the after show. If I'm a CEO and I have Aperitisoft Healthcare installed, I know all the big dashboard items I can have. I can go to you, Rob, my head of quality, and say, how are we doing overall in quality right now? Where do we stand? And you could come right back in and say, well, beginning of the year, we were starting at about a 75% quality level, where we're now up to 85%. I think we can end the year by 90. Now you're measuring progress towards a quality standard that you're setting for your own hospital.
Yep.
And you're able to measure that with the software like ours. Second, I could come to you and say, how are we doing on all these regulatory audits been coming in this year? Again, go right to the system. Say, well, at the beginning, we were cited for the following things. It drove down, raised our risk score to such and such. We put the following measures in place, but we've got our overall risk score down now to about right here. And after our self-assessment, we think we're going to be good going into the next audit. Well, you're not having those conversations with other systems.
No.
It's not happening. Timothy, I can come to you and say, well, Timothy, how are we doing in terms of, incident prevention? You can say, well, we did our proactive risk assessment and we identified all the core areas. And before any of them ever happened this year, we put the following steps in place. We predicted that this would cost us $1 million this year if we did not address them. We invested $20,000 and we think we've eliminated the problem.
I mean, what? And right there, and you're not wrong in those numbers. This could bring us $1 million if we invest $20,000. Right. Even if I invest $200,000 and it saves us $1 million, there's the logic behind not doing that, especially when you have good data that tells you your percentage outcome is this, right? We believe with this level of certainty because of the data that you're going to come out on top with $1 million as long as these things are achieved. Those are very logical. And our regulators, our payers, our programs set us up with clear metrics for payment.
Yeah.
Our regulators, our payers, there's our legal system sets us up with clear metrics and intents. There's in policies and processes that are mandatory that if you have them and you do them and you show it, there's you get paid, or you don't have liability, or you do have liability, or it's not that hard.
No,
That's true.
But it is hard in a marble composition notebook. It is
I don't know
hard.
about you guys, but if I'm sitting on top of a healthcare organization, I want that information,
That's correct.
right?
How
I
many
do as well.
I, as a value-based purchasing, as a pay-for-performance leader, how many times I have been pulled into a budgeting conversation in my career? 2 times, ever. And it was because I had to beg, plead, and beg some more. And I had almost zero ability to communicate what I thought were the high needs of the organization. Shocking, they came away with less than 50% of their total millions of dollars of payout.
Wow.
Yeah.
And all they had to do there's ensure that they put appropriate team members in appropriate places, and it would not really have cost them any significant money.
Simple things. Simple things in life.
Well, Timothy, bring us home, man. Let's wrap it up.
No, we went over
Absolutely.
again. Like, this is
Yeah.
an intense conversation. It just, our leaders need to
I would go very high level because I think we covered a lot. And it goes back to a unified approach to quality. It happens when you have the right data available. It happens when you have the system that allows you to put the information in to process and give that to the leadership team so they can make the appropriate decisions. That only happens when you have a system that's similar to, and if not, just have the system of Aperitisoft Healthcare that shows you that information very clear and plain. No gimmicks, no tricks, nothing beyond that. It helps leaders make the decisions that need to be made to hit the level of quality that I think patients are looking for in not only the current state, but also in the future of healthcare as well. So that comes from building out your core team of quality leaders and having a system like Aperitisoft Healthcare to disseminate that information.
Well, wow, what a podcast and after show today, guys, and a very important topic. We really want the C-suite to be listening to us in this regard. If they can open their eyes to these truths that you guys articulated, they really can have a competitive advantage in their markets and leave everybody in their dust. Absolutely. They really could. So thank you for those who participated live in the after show. Next month, we're getting into discussions about Leapfrog. We're looking forward to those conversations as well. Again, like us out there on YouTube and LinkedIn and everywhere else. Follow us on LinkedIn. We would appreciate it. And we look forward to you joining us next time.
Absolutely.
Bye now.
Thank you.